10 million Americans are projected to lose their health coverage. $1 trillion in cuts to healthcare spending. And yet, the proposal is being marketed as something great, but is it really? Today we're going to take a long, hard look at Trump's $1 trillion health plan, officially called the One Big Beautiful Bill, and ask whether this so-called greatness is actually a disaster waiting to happen. Healthcare in the United States has always been a point of conflict. It's expensive, complicated, and often deeply political. For decades, Americans have argued about whether healthcare is a right or a privilege. Some argue that government should provide a safety net, while others insist that the private market should dominate. Trump's new plan doesn't just tinker at the edges. It proposes some of the largest changes to Medicaid in history. On paper, it saves over $1 trillion in federal spending. But when you look closer, the savings don't come from efficiency or innovation. They come from stripping away coverage and cutting services for millions of Americans who rely on these programs for survival. Let's begin with the numbers, because numbers don't lie. Independent analysts, including the Congressional Budget Office, estimate that around 10 to 11 million people will lose their insurance under this plan within the next 10 years. And that's a conservative estimate. If you also account for the expiration of subsidies under the Affordable Care Act, the number of uninsured could climb as high as 17 million. 17 million Americans left without health insurance. That is nearly the entire population of Florida suddenly cut off from care. Now imagine the consequences of that. Experts say that with the loss of coverage, the country could see as many as 22,000 additional preventable deaths every single year. That's like losing the entire population of a small town, year after year, simply because people no longer have access to doctors, medicine, and hospitals. In addition, about 2.5 million people could lose their primary care physicians. Families who have built long-term relationships with their doctors could suddenly find themselves without anyone to call when their child spikes a fever, when their parent has chest pain, or when chronic illnesses need management. Add to this the projection that more than 1.5 million families could fall into medical debt because of these cuts. Debt that can lead to bankruptcy, ruined credit scores, and years of financial struggle. So while the plan promises financial savings at the federal level, what it really does is shift the burden onto ordinary people. People who are already struggling. People who will pay with their health, their finances, and in too many cases, their lives. But here's the most shocking part. While millions of ordinary Americans face losing Medicaid coverage, the wealthiest 1% of the country stands to gain billions in tax breaks. That's right. This plan is not just a healthcare policy, it's also a massive redistribution of wealth, upward. Money is being taken away from programs that serve the poor and middle class and redirected to the rich in the form of tax relief. Supporters call it reform. Critics call it robbery. Let's think about rural America for a moment. Small towns are already in crisis when it comes to healthcare. Rural hospitals have been shutting down for years, often leaving entire counties without a single emergency room. Under Trump's plan, the pressure will intensify. Medicaid is a lifeline for these hospitals, and when it gets cut, many of them will simply close their doors. The government has promised a $50 billion relief fund to help struggling rural hospitals. But experts say this is nowhere near enough to cover the losses. Imagine a farmer in Kansas or a grandmother in Alabama needing urgent care and finding that the nearest functioning hospital is over 100 miles away. Those are the stakes. This isn't abstract. Let's make it personal. Picture a working-class family with a diabetic child. Medicaid helps them afford insulin, doctor's visits, and checkups. Without coverage, the parents are forced to choose between paying rent or paying for medication that keeps their child alive. Or think about a senior citizen living on Social Security in a rural county. The local hospital closes down because Medicaid funds were slashed. Now, every time she needs care, she has to drive hours, maybe across state lines, just to see a doctor. Or consider a young mother who needs surgery but discovers her insurance has been stripped away. She puts it off, hoping her condition doesn't get worse, but each day her health declines. These are not dramatic hypotheticals for the sake of argument. They are the very real scenarios that millions of Americans will face if this plan moves forward. Trump calls it great. He says it's about efficiency, about saving the country money. But greatness for whom? The truth is, what's being sold as greatness is really a massive cost-cutting exercise with devastating human consequences. If greatness is measured by how many billionaires get tax relief, then maybe the plan lives up to the name. But if greatness is measured by how well a nation takes care of its people, this plan is a failure before it even begins. Let's take a step back and look at history. Medicaid was created in 1965 as part of President Lyndon Johnson's Great Society programs. It was designed to provide health care to low-income families, children, the elderly, and the disabled. Over the decades, it has become a backbone of the American healthcare system. Today, over 70 million people rely on Medicaid. That's 1 in 5 Americans. Cutting it so drastically isn't just trimming a program. It's ripping apart one of the foundations of healthcare in this country. Critics argue that the plan amounts to a reverse wealth transfer. Instead of redistributing resources to help those in need, it redistributes them to the wealthy. The government saves money by denying care to the poor, and then turns around and gives tax breaks to the richest individuals and corporations. This isn't healthcare reform. This is healthcare regression. But let's also consider the political narrative. Supporters of the bill argue that Medicaid is bloated, that it encourages dependency, and that reform is necessary to keep the budget under control. They frame it as tough love, the kind of discipline the system needs. But here's the problem: discipline shouldn't mean letting people die. Budget control shouldn't mean leaving children without insulin, seniors without hospitals, or families bankrupt from medical bills. There's a difference between efficiency and cruelty. And this plan crosses that line. The politics of calling it great is a rhetorical trick. By labeling it as something positive, the hope is that people won't look too closely at the consequences. But when you peel back the label, what you see is millions of people losing access to healthcare, thousands of preventable deaths, rural hospitals shutting down, and a nation more divided than ever along class lines. So the question we must ask is simple: what kind of America do we want? Do we want an America where healthcare is considered a basic right, something that every citizen can access regardless of income? Or do we want an America where only those who can afford it survive, while millions are left to fend for themselves? This plan forces us to confront that choice. Now let's think about the broader impact on the healthcare system itself. When millions lose coverage, it doesn't just affect them individually. It affects everyone. Emergency rooms become overwhelmed with uninsured patients. Hospitals raise costs for insured patients to make up for losses. Doctors burn out under the strain. Premiums for private insurance rise. The system becomes more unstable, not less. So even if you personally are not on Medicaid, you will feel the ripple effects of these cuts. This is not just about them. It's about all of us. And then there's the economic cost. Cutting Medicaid may save the federal government money on paper, but it creates hidden costs everywhere else. Families forced into medical debt can't spend on housing, education, or local businesses. Workers who lose coverage may get sick more often, miss work, and become less productive. Rural communities that lose hospitals often see businesses leave because healthcare is a critical part of local infrastructure. So what looks like savings at the top quickly turns into losses at the bottom. Let's not forget about the moral dimension. America is one of the wealthiest countries in the world. Yet, we are the only developed nation that doesn't guarantee healthcare to all its citizens. Every other advanced democracy has found a way to do it. And yet here we are, cutting programs that serve the poor, while showering tax breaks on the wealthy. What does that say about our values? What does it say about our priorities? The one big beautiful bill is being sold as reform. But reform means improvement. Reform means making something better. This bill doesn't do that. It makes things worse. It is, at its core, a $1 trillion transfer of pain from the government's balance sheet to the backs of ordinary Americans. And so we return to the question, is Trump's $1 trillion healthcare plan really great? Or is it a catastrophe in disguise? To call something great is easy. To make something great requires vision, compassion, and fairness. None of those qualities are present here. Instead, we see cold arithmetic, political spin, and devastating consequences for millions. If this shocked you, if it made you think twice about what's really going on, hit that like button. Share this video with your friends and family so more people can understand what's at stake. And don't forget to subscribe for more deep dives into the stories that truly matter. Because when it comes to healthcare, silence is dangerous, and ignorance can cost lives. The question remains, is this plan really great? Or is it the greatest healthcare disaster America has ever seen?